Your therapy guide.
Your ultimate guide to health and fitness.
Hi there, I'm Subhas. I'm a registered physiotherapist. Today, I'm going to reveal you some secrets on how to get rid of plantar fasciitis or your foot and heel pain based on latest research finding and my own clinical experience successfully treating patients with foot and heel pain. Plantar fasciitis as such is a very common condition that causes intense pain on your heel, which in some instances also extends to the inside border of your foot, especially when you take first few steps in the morning or getting back to your feet after a prolonged period of rest. It's important to understand that plantar fasciitis is not just the problem of the foot. Plantar fascia is the victim rather than the culprit, causing the debilitating foot pain. Thus, the treatment that is just focused on the foot is not going to treat all the causes of plantar fasciitis. That's why I often hear from my patient that I have tried everything and I am doing the exercises religiously and still I don't feel much change. Well, it makes sense to me because unfortunately most of the exercises and treatments are just targeted on the foot and we often tend to miss to address the causative factors which is not exactly located on the foot. Thus, the treatment or the exercises focused on foot might help you decrease the pain to some extent but do not take care of it completely. When the load on the plantar fascia exceeds the tensile strength of the tissue, it might cause some amount of inflammation, thickening, tightness and formation of the scar tissues and degeneration of the plantar fascia collagen fibers. Thus, this video is going to be an exclusive video for those with heel pain and foot pain, as I am going to reveal the secrets on how you get rid of these kinds of foot pain completely through these simple exercises by addressing almost all possible causative factors from its root. So without any further delay, let's get started. Get a frozen water bottle. Place it on a towel and roll it under the affected foot. It allows you to ice the foot for an extended period of time while massaging taut and constricted tissue at the same time. You can do it 3 to 4 times a day for 15 to 20 minutes. Be careful using it for longer than 20 minutes as it increases the chances of frostbite. Keep your thumb on the foot, starting from the heel. With some pressure, slide your thumb towards the side. Spend more time on sore and tensed spots. Work throughout the length of the foot. If you do this maneuver before you go to bed and also before you put your first step in the morning, it makes your early morning pain way less intense. If you can handle more pressure than just using your thumb, exercise it using a tennis ball. Divide your foot with 3 imaginary longitudinal lines and roll the ball with some pressure along the line. You have to work on all the areas of the foot. Repeat this for 2 to 3 minutes. Work on all the areas of the foot. Posterior portion of the plantar fascia is connected to the Achilles tendon. With this exercise, you want to stretch both Achilles tendon and plantar fascia. Place a towel under your leg. Remaining portion of the towel wraps the undersurface of the foot, toes pointing towards you, and hold the other end of the towel with your hand in such a way that it positions your foot in upward and inward angle. Now slowly pull the towel back towards you. Hold for 30 seconds to 2 minutes. Repeat for 3 to 5 reps, 3 to 4 times every day. You might feel a stretch on the back and outer portion of your leg and also the sole of your foot. Get onto the floor. Roll the tennis ball under your leg to find the tight and tender spot on your calf muscles. After you find the tender spot, keep pressing the area against the tennis ball. If you want more pressure, you can add some upward and downward movement of your ankle and foot, or even get your other leg and place it over the leg you are working on for more intense release. It feels tender to work on the tense muscle fibers. Hold for 30 seconds to 2 minutes on each spot and similarly work on other tense tissue area. For calf stretch, stand facing the wall, neutral spine, belly button in, and shoulders back and down. Get your leg on the side to be worked on one step back. Keep your back knee straight. And bend your front knee. Keep second toes of both feet aligned with the heels and slowly lean forward, trying to get the front knee closer to the wall. After you hold it for 30 seconds, slowly bend the back knee too. Hold it for another 30 seconds and repeat 3 to 5 reps 2 to 3 times per day. After you do this for 1 to 2 weeks or few weeks and already got some good stretch, you may start to do this exercise with your fifth toe of the back leg aligned with the heel instead of the second toe. Work with the back knee in both straight and bent position. 3 to 5 reps, 2 to 3 times per day, every day. And don't forget to work it on both sides. Calf stretch can be further progressed by doing this exercise using a folded towel underneath the front half of the foot. Get your leg to be worked on one step back by moving your other leg forward. Keep your back knee straight and second toe aligned with the heel. Lean forward by bending your front knee further towards the wall. After you hold this position for at least 30 seconds to 2 minutes, bend your back knee and hold for another 30 seconds to 2 minutes. Both heels should be on the floor throughout the exercise. Placing the towel under the foot gives you extra ankle range of movement to make your muscle stretch even more. As plantar fascia is rich in type 1 collagen fibers, tensile stress on this tissue helps to prevent and heal the tissue degeneration. Use a folded towel under your toes, focused on first toe extension. Slowly lift your heels off the floor, which further extends the first toe, including the other toes, and increases the tensile force on the plantar fascia. Over time, doing these exercises increases the tensile strength of plantar fascia. To increase the load, you may use weights on your hand or progress to single leg standing and single leg standing with the weights. Let's work on gaining some rotation range on your spine and pelvis. Lay down on your back. Bend hip and knee off one side towards the chest and across the body. Use the opposite hand to hold the knee. Move the other hand and upper body in opposite direction. Hold for 30 seconds to 2 minutes. Repeat 3 to 5 times on each side. This improves the rotational mobility of your spine and pelvis, which helps to improve the lower body mechanics, thereby reducing stress on your plantar fascia. Lay flat on your back. Hips and knees bent with your feet shoulder width apart. Neutral spine. Shoulders back and down. Gently pull your belly button towards the spine and hold. Contract the muscles around your private area and pull it towards your tummy. Squeeze your glutes and lift your pelvis off the mat until you form a uniform inclination from your knees to your shoulder. As you lift your pelvis up, don't let your knees collapse and put equal pressure on ball of first and fifth toe and heels. Hold for 5 seconds. Repeat it for 15 to 20 reps, 1 to 3 sets once every day.
Subscribe to our channel for our newest exercise videos.